Hello, everybody. Thank you so much for joining me over here on track 2. Yes, my name is Allison. I am with the ADA. I am the digital archivist and publishing librarian for the ADA. I manage our instance of digital commons, and I also collaborate with our archivists on digital initiatives. I'm going to talk to you today about our repository. It's a little bit unique from a lot of folks here work in higher ed, and so our repository is really more focused on journals and less about behaving as sort of a traditional IR for like student and staff work. So that's what I'm going to kind of talk about a little bit today, and just overall share how we're using digital commons. First things first, let's see. Okay, that's still me. There's the title. Okay, who is the ADA and what is a tripartite? So I always like to start every session that I give with, we're not the Americans with Disabilities Act, and we're not the American Diabetes Association, we're not any other ADA, we are the American Dental Association. So the ADA is the primary overarching professional organization for dental and oral health professionals. We were founded in 1859. We are based in Chicago, but actually have a presence across all states and territories through the tripartite. So what is a tripartite, you may ask? The way that the ADA is set up is that a dentist cannot actually just belong to the ADA. They also have to belong to their state and their local society or association. So if you're a dentist in Chicago and you want to join your professional organization, the ADA, you are also a member of the Chicago Dental Society and the Illinois State Dental Society. And there's lots of different benefits of having these sort of different levels. But one thing that is common across both is that they all have some sort of member publication. This might range from a peer-reviewed journal to a newsletter to a magazine, but they all offer that to their members. Okay, so that's what a tripartite is. I promise this is all important. The ADA also has a House of Delegates. So the way all of these member societies are represented up to the national level is through the House of Delegates. The members come from the state and local societies. They represent their region, and key to why I'm here today, they bring forward ideas to the House. So those ideas may become resolutions, the House debates, eventually votes upon. It works perfectly, just like our own governmental system. Resolutions which pass have responsible parties attached. That might be ADA national. It may be a combination of ADA and states. It just kind of depends on what that project is. Okay, so that's a little bit of background. So what does this all matter? As I mentioned, every state and local group has a member publications. For many years, members of the tripartite groups had been calling for assistance to both preserve that work, but also be able to better share it outside of their membership. Right now, publications are pretty much just kind of kept on websites. You might get 2 to 4 years worth of content on the website. Some are open access, some are behind a membership wall. Some use a flipbook tool like Issue or Flipbook. Others are just a simple PDF download, which is what you see here. This is how one of our groups promotes their materials, and it works for them, but it's very basic, right? There's no images, it's simply a PDF clickable link. And so everybody kind of has different methods of delivering their content, but one thing that is consistent is none of them are really archiving any of that content. Some of the groups have been publishing for over 100 years. We have one group that has actually digitized all of their issues back to their founding in the 1860s, but they're all sitting on external hard drives. They don't know what to do with any of it. These societies are often 2 to maybe 4-person shops. They're invested more in membership development, in writing their newsletter, in putting on events, and they're not librarians, they're not information professionals, they don't know what to do with this stuff. So with this one group, they digitized all of this. It's sitting on hard drives. It's been sitting on hard drives for years, and they're stuck with it. They don't know what to do. And so they've spent all this money to digitize, and they're just risking it by having it sitting on these hard drives. So it's not me trying to blame anyone for the state of things. We all know this happens, right? This is not an unusual refrain that any of us hear. But what's great is that the affiliate societies, they all know that this is a problem, but they don't have the IT capacity, the staffing, the knowledge to archive any of their things. So that was one concern that folks had. The other was access, of course. Societies are creating publications with clinical research articles, practical day-to-day management guidelines, but they can't be searched through their websites. Websites, of course, aren't really designed for archiving. Issues and articles are not indexed, so they're not found through the Googles of the world, and it's really only accessible to their state or local membership. So one example is a member dentist might be struggling with a practice issue in New Orleans, and then discover or have no idea that a year earlier, someone in Denver had written something about that, but there was no connection. There was no way to know any of that was happening. So there's all kinds of examples of that with legal issues, HR issues, clinical issues. There's all this overlap, but everyone's kind of fending for themselves out there to figure it out. So the members saw this. They were frustrated by this. They wanted a solution. And then the pandemic happened. And suddenly these issues became very, very dire. So dentists were scrambling to find information on how they could treat their patients safely, as well as safely for themselves. We know dentists were very much on the front lines. You're dealing with people's mouths, and you can't wear a mask when you're at the dentist. So it was really a struggle for dentists at that time. And they also realized that there were few records available. There was very little published before that they could find from the pandemic in 1918. So that was all going on. At the same time, societies were still publishing clinical peer-reviewed research on the topic. They were writing experiential columns on how they were operating during that unprecedented time, but the work was only being seen at their state or their local level, not by any other ADA members. So they realized it was vital to preserve this knowledge and make it accessible to future dentists that might face something similar, because the likelihood is we will have another pandemic. So here's this idea. Members brought this forward to their tripartite leadership, and in 2021, a contingent of the House actually brought forward a resolution to investigate a nationwide database solution. The resolution passed, yay, and member volunteers and ADA librarians, yay, were tasked with the discovery process. This uncovered a range of needs by the societies that are highlighted here. The task force finally reported back to the House of Delegates in 2022 with a potential solution found in digital commons. At that meeting in October, there was some very spirited debate about if this was needed or not, but the House did finally pass the resolution to fund ADA Commons, which is a new global open access dental repository. And then we had to build the thing. It was a very intense spring and summer by the staff of the ADA Library, but ADA Commons did launch just almost exactly a year ago in October of 2023. You can see, I have to forward a thing. You can see our finished product here. It is now the official repository for our tripartite member groups to publish and archive their journals, newsletters, conference materials, CE videos, podcasts, scholarly works, all of it. It is voluntary for them to participate, but part of my job is to help them see the benefit of participating, because it is an add-on of work for the societies. But I do always like to come back to what I love about this project is that it was driven by the membership. This didn't come out of ADA National. It didn't come from our leadership. It wasn't the CEO or the president or anybody that said, let's do this. It was the members that brought this up. So they are very devoted to this project, very committed to seeing it succeed, which I find is often very rare in the world, that things actually get to come up from the users. So that's always very exciting to me. And on top of it, they recognized the importance of this. They recognized the writing they were doing and the science that they were delivering was important. And they voted to preserve this, even knowing that would raise their dues. Because as you can imagine, this is not a cheap project. We have a lot of societies and locals, so this isn't a one-off thing. It was an expensive proposition, and they still saw the value of it. Okay, so Let me go back one. You can see here we actually do have a number of different communities, only one of which is state and local publications at the top. So we do have a number of other collections on the site, which I will get into in a minute. But I will quickly go through a little of, well, maybe not quickly, actually, a little of what our process is to onboard our state and locals, because we really Sherpa everyone through the entire process. For most of them, we actually do almost everything for them. So our process may or may not be a little different than yours. We currently have 7 live journals. We just started a year ago, so we're growing. But we have 8 societies in process. There are over 1,000 tripartite societies, so job security, right? Hopefully. As I mentioned, each of the society does have very specific needs, so that's kind of why we walk everybody through give them a very personalized experience during their development stage. All right, so this is a little snippet of how we manage onboarding. When someone reaches out to us, they are curious about it. We sit down with them over Zoom, we give them a tour of the site, we find out what their specific needs are, what roadblocks that they might have. They often ask how much it costs, and it's always our favorite answer is that it doesn't cost them anything because it's part of their member benefits as belonging to ADA. Each group does get their own custom site for their journal. This was obviously a very key need for the tripartite members, is they all have their own brand. So Illinois State Dental Society does not look like the ADA. It looks like, am I on? Okay. It looks like the Illinois State Dental Society. So that was really important. So what we actually end up doing is we grab a lot of their materials, their brand, their color, all of that, and we create some mock-ups for them. We recognize that DC can provide that service to a certain extent. You can give them the information, they can create it. But what we found is that our groups get on board a lot quicker if they can see something right away before they kind of get into the more in-depth process with the DC designers. And we can sort of manage their expectations and make sure that something is being built out within the framework that DC provides, right? And honestly, our rep is here and they are wonderful, and I think they would probably say thank you, because it would be so many emails. Because there's always just a lot of questions from our folks. So we guide them through, we give them those mock-ups, we work on the journal design form together. They still, of course, have all the final approvals of their design, of their sandbox. We walk them through their sandbox. Some of our groups want to manage their own site, but most of them actually want us to manage it for them. So we do all of the uploading, all the back content, all of the ongoing sort of work for them. In some cases, we develop some of their metadata, but there's a couple of them that do their own. And for those folks, we provide them with written and video instructions, as well as they do a training, of course, with our rep, so they can understand how to manage the site. But we're always there to continue to support them. And then we also develop, the thing on the left is a metadata form, just to help guide them through what they need to provide to us every month with their issue, because that is often forgotten. Okay, so here we are. We've got 7 publications. We've got about 900 items specifically to the state and local collections. We've had 3,500 downloads from 155 countries, which is thrilling for us as well as for our participating publications. One of the big goals was to, provide access, and global reach was one important key to that. We really wanted to see this become an important dental repository for folks around the world, and within a year, we've really seen a huge bump in that. We actually had someone back at the national office say, okay, so the goals for the ADA Commons are what you want to get to 5 states in the next 5 years? Downloads from 5 states in the next 5 years. And we're like, oh, honey, we blew that out of the water in week 2. So anyways, we've been very excited about what's been happening with that content. I don't say our content because it's the state and locals content, of course, still. We're also looking at, going forward, building a newsletter so we can kind of create a community with our different participating societies that will show off new participants, give tips and tricks, that kind of thing. We support societies seeking DOIs with that process. Right now, we only have their publications up, but we do have one group that wants to add their podcast and another that eventually wants to add conference material. So it'll be great to have that as well, just to give some more examples of what's possible. So I did say I wanted to go back to a little bit more of what we have in the collection. So obviously the primary thing here and the reason it was built is the state and local dental collections. But we really saw this as an opportunity to maybe do more. As I mentioned at the beginning, I work with our archivists on digital initiatives. So we really saw this as an opportunity to start adding ADA archival content. And so ADA Commons now serves as our archival repository for digital materials. So we're constantly sort of building new collections there. We've got ADA newsletters, archival pamphlets that were provided to dental offices, which you'll see in a second, and there's a really cute one. Press releases, past ADA bylaws, code of ethics statements, transactions of the ADA, which are summaries of House meetings, and information on ADA past presidents. And actually, those transactions have been very interesting. We had one immediately go from 0 downloads to 150 in like a week, and we didn't know why. And it turned out it had a really big statement on fluoride in it. And I don't know how many of you follow the adventures of fluoride in the world, but there's been a lot of controversy because of some research that came out. And so clearly they found the research that ADA did back in 2008 on fluoride, and that has been actually downloaded around the world, but also quite a bit in DC. So interesting. All right, one last thing. We're going to be launching our individual scholarship collection soon too, that you can see here. So that's going to be an opportunity for our staff to use this like a traditional institutional repository, but it's also going to be available to our members. So if they're publishing and they would like to add a preprint or whatever approved version of their article they can, this will be available to them. So we do have a lot of dentists that are not affiliated with higher ed at all, and so don't have access to an IR. So this will provide them that, which we're excited about. All right, so I wanted to share this because I love Mr. Rogers, and he was featured on a pamphlet probably back in the 80s maybe, about going to the dentist. So these are just a few items from our archives that I always like to share because they're cute. One other thing, I'm not going to talk about this too much because if you really want to know about our digital exhibits, we did a webinar for Elsevier last week on digital exhibits. At some point, that recording, if it isn't already, will be up. So you can hear me talk for another 20 minutes about digital exhibits. But we have loved having this feature, and we just started using it in May, but we have 2 and almost a third exhibit up. We have an exhibit on military dentistry launching next week, which you can see the top right. That is Lieutenant Osborne, who died in World War I. He received the Medal of Honor. He died in combat, saving some of his comrades. So this exhibit has been such fun to put together. And to really, and the one below it too is another exhibit we did just before the Olympics on dentistry and sport. And we've just loved that opportunity to make the contents that are in the repository just that much more accessible, right? It's entertaining, it's engaging, it's timely. The military exhibit is actually in conjunction with what the ADA Foundation is doing, a program called Give Vets a Smile. Most people don't know that dental care is not part of VA benefits after you leave the military. And so a lot of veterans struggle with getting dental care. 82% don't have any sort of dental care after the military. So that program is really trying to bring that to light. And we wanted to be able to support that with an exhibit that is not only about dentistry in the military historically, but also we have a feature of how you can help. So as people visit this exhibit, they can learn more about different groups that are providing that sort of support, dental support to vets. And the last thing I have before I can take questions is we're also really proud of
being able to contribute to the field of Dentistry Commons, of Digital Commons. So we have about 3,100 items in our repository, which isn't a lot compared to many, but 200 or 2,600 of those are specific to dentistry. And so within Dentistry Commons, we have a large amount of material there. And because of our focus on dental disciplines, we did notice some fields were missing or we thought needed to be refined. And we submitted about 9, and 5 of them were accepted that you can see here. And so we were really chuffed that we were able to contribute in that way and recognize like how we could help make this even better, right? Like we all want Digital Commons to succeed and become the best thing there is. So we were really happy to be able to contribute to that. You'll also notice, if you can read it, under popular articles, that article Sinus Tract versus Fistula, which sounds horrifying, but that is from our New York State Journal. It has been the #1 downloaded item in our collection since New York went live in late December, and it has actually caused a little rivalry between our New York and Michigan chapters, because Michigan was the first to go live, and so they held the top spot for a long time, and then New York came along, the little upstarts, and took over. So the two people are friends, 2 of the editors are friends, so there's always a little bit of, so we love seeing that continues to stay up there. So I am happy to take any questions people might have. I'm gonna leave up this slide just with my contact information. Happy to reach out at any point if you have more questions for me, want to connect on LinkedIn, or check out our comments. Yes.
Hi, Allison.
Hi.
I want to give some praise. So I'm Jennifer Pizetsky from Digital Commons, and I led your kickoff call, and I've been impressed with you ever since. I've been watching your repository grow, and I love it. But my question is, have you considered training or having us train your journal, the state journal editors, so they do their own uploading?
Yeah, so we do offer that. So we would love to have all of them do their own, but what we found is some of them won't even consider participating unless we do it for them, which generally is fine. There's 2 of us, but we do have 2 groups that are managing their own. And so with those, once we're in the sandbox, we have Kirsty meet with all of us over Zoom and do the training, and then kind of put it in their hands, and then we're just here to support them as they need. So yes, we are. Combo.
Hello. I'm from Virginia Commonwealth University. I'd love to talk Virginia Dental Journal with you.
Yes, okay.
I have questions.
Yes, I'm sure.
But a broader question for the group, so as not to get in the weeds. When we digitized Virginia Dental Journal, a lot of the historical journals had social security numbers, had images of minors. How are you addressing things like that with your participants?
To be honest, we haven't. They're the ones that they're delivering their content to us. So we have kind of left that in their hands. And at this point, most everything they've given us is within the last 10 years. So we don't have anything that old yet, but we potentially will. So I think we'll have to do a better job scanning for some of that older stuff. But yeah, let's talk after, because they're one of our sites that's going live, but we're working with VCU on, well, we haven't actually sat down and talked, but I think Shannon has hopefully talked to you guys, but we can talk. Oh.
Hi, I'm Pramita from Digital Commons. I love what you said in the beginning, that this was really from the members, and I wanted to kind of ask a little bit more about that. Like, what were they coming to you? What were their needs? What were their materials? Was it mostly journals, or was it across the board?
Yeah, so I think the main focus was journals. So it was primarily the states. It was a little less the local groups, because they tend to do more newsletter, like less peer-reviewed stuff. So it was really the states coming forward because they knew they were publishing clinical research, but they couldn't get anything indexed because they just didn't have the cachet to get even into Scopus or anything like that. So they wanted to be able to at least start archiving. Maybe less, nobody's really using it as a publishing tool yet. They're still publishing on their own end. But I think the big thing was often the archiving and just getting out there and getting more visible. All right. Well, thank you all so much for joining me. I really appreciate it. And I hope everybody has a great conference. Stay cool.